Hello, my name is Dr. Bianca Madrigal, physical therapist.
And I'm Dr. Renee Kunkel, physical therapist. And we're going to talk about Kegels today. Frequently people either read or are told by someone they know that they should be doing Kegels. And a very common patient population that occurs in is women postpartum. So during birth, so this is the uterus, your ovaries, and then your fallopian tube. So the uterus, we all know, is where the baby grows inside the mom's belly. And then the bladder, this is the bladder, sits right underneath the uterus. So commonly women are like, why do I have to pee all the time? Well, it's because the baby is sitting right on top of the uterus and is pushing down. And so this sits in your pelvic floor just like here. And either while the moms are pregnant or after they give birth, they experience something that we call incontinence, which is where they experience a leakage, or they'll actually have urine either on their underwear or they're completely soil their underwear. And so oftentimes they're told either by friends, doctors, whoever, or they read on the internet that they need to do a Kegel. So here in pelvic floor therapy, we talk about Kegels as pelvic floor contractions. And a pelvic floor contraction is just like any other muscle. You are making the muscle shorter. And so what we do is we do a pelvic floor exam to assess those muscles to see how they're functioning. Are they contracting as well as they should be? Are you able to relax? And so in order to actually answer the question, should you be doing a Kegel, it requires a pelvic floor assessment by a physical therapist. So your gynecologist or your gynecologist will do a pelvic exam, and sometimes your primary care doctor will too. The difference of the exam between your medical doctor and a physical therapist is your medical doctor is screening for medical conditions, whereas here we're physical therapists, so we're screening the muscles. How are the muscles functioning and how are they working as they should be? So Kegels, if you're doing them and you have what we call a hypertonic pelvic floor, where your pelvic floor is a little hypertonic, where the muscles are actually contracted, they're more turned on in their rested state, then Kegels might be making the problem worse because they have this small excursion they're going through this small excursion and they don't know how to relax very well. So when you go to the restroom, your pelvic floor needs to relax and drop in order to allow yourself to pee. So how I like to explain it is your pelvic floor in your brain gets confused. It's not sure when it should pee. So when it gets the urge that needs to go, it relaxes enough to allow urine to come out, and now you have incontinence. So, or the opposite is you could be weak and you do need to do some Kegels, but you need training to know how to do them correctly. So oftentimes women come in to see us, and men can do Kegels too, and they're squeezing their butt muscles, they're using their belly, they're using their adductors, which is your inner thigh muscle, they're using all the muscles around your pelvic floor. And sometimes they're getting the pelvic floor contraction in addition to, and sometimes they're not. And that's where we come in, is we really train you how to activate that pelvic floor appropriately.
So if you're having any issues with your pelvic floor, pain or incontinence, please feel free to come see us at Balance Physical Therapy and we can help you out.